Hey guys, my name is Shrey Gadigankar, and today I'm going to be talking about Hodgkin lymphomas. Whenever we talk about any question in the pathology file, we want to set a specific framework and then build up on it. So in this section, we'll be talking about what are Hodgkin lymphomas, like the definition, the difference between Hodgkin lymphomas and non-Hodgkin lymphomas, the classification, and the clinical features. So, Hodgkin lymphomas encompass a distinct group of neoplasms that are characterized by the presence of a tumor giant cell, which are known as the Reed-Sternberg cells. So, these are basically derived from B cells of the germinal center, and they release a lot of cytokines that can induce accumulation of inflammatory cells and eventually lead to formation of a mass. So over here we can see the Reed-Sternberg cells. Sorry. These are classically known for having a owl's eye appearance. Regarding the pathogenesis, so these usually involve activation of the NF kappa B pathway. So this pathway can be activated either by Epstein-Barr virus or certain other mechanisms as well, and it basically leads to the proliferation of B cells and their fusion. So, as mentioned, the Reed-Sternberg cells, they usually secrete cytokines that attract inflammatory cells. These inflammatory cells have the ability to cross-talk with the Reed-Sternberg cells by producing factors that support the growth and the survival of Reed-Sternberg cells by upregulating this NF-kappa B pathway. Hodgkin lymphoma is a specific example of a tumor that kind of escapes from the host immune response by expressing certain proteins that inhibit T cell function. So something more about it is that it's more common in men compared to women, with the exception of nodular sclerosis type, which is more common in women. It's associated with EBV, as mentioned, and there's a high incidence in HIV patients. So here's the difference. So in both Hodgkin and non-Hodgkin lymphomas, they may present with what is known as the B signs or B symptoms, which are characterized by low-grade fever, night sweats, and weight loss. So unlike most non-Hodgkin lymphomas, the Hodgkin lymphomas usually arise in a single lymph node or a chain of lymph nodes that are spread in a stepwise fashion. And in the case of non-Hodgkin's, there's usually multiple nodes involvement, so there may be also extra nodal involvement, and this is usually a non-contiguous spread. As mentioned before, Hodgkin lymphomas are usually characterized by Reed-Sternberg cells, and in non-Hodgkin, there's a majority of B cells, and a few of these are might be of T cell lineage as well. You also have the distribution, the demographic which is affected. For instance, in Hodgkin's, it's usually a bimodal distribution, and like it involves young adulthood as well as people over the age of 55 years. Uh, in non-Hodgkin's, it may occur in children and adults. And Hodgkin's, as mentioned, is association with EBV, and in non-Hodgkin's, there may be association with HIV as well as certain kinds of autoimmune diseases. So, in general, the most frequently involved lymph nodes in Hodgkin's lymphoma involve the cervical lymph nodes, the supraclavicular lymph nodes, as well as the anterior mediastinal lymph nodes. So this is the WHO classification of Hodgkin lymphomas. So these are classified based on specific cell markers. So in the case of classic Hodgkin lymphoma, these are usually positive for CD15 as well as CD30. Um, on the other hand, type are negative for CD15 and CD30, but they're positive for CD20. Um, the classical Hodgkin lymphomas may not be, they're usually negative for CD20. So these markers are they're necessary, but they're not sufficient for the diagnosis. So coming on to let's just go through each of the classification individually. So initially you have nodular lymphocyte predominant. So this is the non-classical type. So these are CD20 positive. So as mentioned before, so these usually don't have an EBV association. So this is the only one that does not have an EBV association. The classical ones usually do have an Epstein-Barr virus association. Regarding the microscopy, so as mentioned, these typically involve cervical or axillary lymphadenopathy. We have a picture for the microscopy over here. So these usually are involve predominant lymphocytes with some macrophages effacing the lymph nodes. Uh, a characteristic variant of the Sternberg cell is the lymphohistiocytic variant. So these are also known as popcorn cells because the nuclei resemble exploded kernels of a popcorn. You may see one over here, for instance. So, as mentioned, these are CD15 and CD13 negative, and thus that's what makes these non-classical. But they do express CD20, and these usually have an excellent prognosis. The first type of the classical uh, Hodgkin's lymphoma is the nodular sclerosis. So this is the most common subtype and also most commonly affecting women. Um, The macroscopy, these usually involve cervical and medial lymph nodes. The microscopy is usually characterized morphologically by collagen bands. So these usually divide the lymph node into circumscribed nodules. So I have a picture for that in the next slide. And you also have specific characteristic Reed-Sternberg cells, which are known as the Lacino variant Reed-Sternberg cells. So these are basically single multilobate nucleus. So you can see over here like the different kinds of like they're septated as well as there's different kind different uh, large number of nuclei as well. And the prognosis of this is usually excellent. So as mentioned, this picture basically shows the well-defined the bands of pink acellular collagen, which is why this type of Hodgkin lymphoma is known as nodular sclerosis. You also have a mixed cellularity type. So this is the second most common, and mostly associated with EBV, and it's common in HIV as well. So this subtype is more likely than nodular sclerosis to be disseminated and to be associated with systemic manifestations. So macroscopically, these may affect abdominal lymph nodes as well as the spleen. And microscopically, we have a picture over here. So it's known as mixed cellularity because of the numerous different kinds of cells that are present. So you have eosinophils, plasma cells, lymphocytes, and you also have your characteristic Reed-Sternberg cells, as you can see over here. And they may be mononuclear variants, as this one over here. And the prognosis of this is usually is good. The last two types are the lymphocyte rich and the lymphocyte depleted. So lymphocyte rich, in the name itself, we know that there's a large number of lymphocytes. So these are usually this type is usually uncommon. However, it does affect older adults, adult males, more common than females, and there's an EBV association as well. Microscopically, reactive lymphocytes are the majority, as mentioned. They may be also classic Reed-Sternberg cells, and the prognosis of this is usually excellent. Lymphocyte depleted, as mentioned, this from the name itself, we know that uh, the lymphocytes are depleted. So there's fewer lymphocytes and more number of Reed-Sternberg cells, and this among the others usually have a worse prognosis. So regarding the clinical features, they usually have B cell symptoms. So B symptoms. So these involve low grade fever, weight loss, and night sweats. The night sweats basically involve loss of large volumes of water during the night, and the patients may complain that they have several times because of the large amount of sweat that they produce. You also have pruritus itching, and this is mainly due to the cytokine involvement in Hodgkin lymphoma. There might be an uncommon fever variant known as the Bell-Epstein fever. These are characterized by alternating bouts of fever followed by remission. You may also have lymphadenopathy because this is a lymphoma, and it is usually painless. However, it might become painful if the patient drinks alcohol. Apart from that, you may have other signs that are non-specific, like chest pain, cough, dyspnea, and they usually indicate the presence of large mediastinal mass or metastasis to to the lungs. There's also an increased risk for developing AML as well as non-Hodgkin's lymphoma, but this is mainly due to treatment with radiation and alkylating agents. So regarding the prognosis, the clinical stage is usually more important than the type of Hodgkin's lymphoma. For instance, the stages 1 and 2, they have lymphadenopathy above the diaphragm, and this is associated with an excellent prognosis. However, in the more advanced diseases, like in stage 4, for instance, the 5-year survival rate is 60%. Something to remember is that patients who have Hodgkin's lymphoma, uh, the prognosis is usually indirectly proportional to the number of Reed-Sternberg cells. So for instance, if they have high number of Reed-Sternberg cells and a lower number of lymphocytes, that's usually a bad prognosis. Treatment of this usually involves radiotherapy, chemotherapy, biological therapy, etc. So that's all from me. Thank you.